Welcome to the Deep Dive. Today we're taking on a topic that's, well, incredibly important, organ donation.
Absolutely. It's such a powerful act, isn't it? This incredible gift that can completely change someone's life, turning, profound loss into hope.
It really is one of the most amazing things one person can offer another. And we're focusing today on Kerala, a place in India known for its really progressive healthcare.
That's right. You'd think it would be leading the pack, wouldn't you? Given its reputation for medical advancements. A real pioneer in many ways.
You would assume so. But here's the surprising part, the unsettling truth we're exploring. Kerala is actually facing a major challenge with organ donation right now.
Mm-hmm.
It's a trend that MLAM Vincent highlighted just recently, August 29th, 2025, in the Legislative Assembly. This growing, quite shadowy role of middlemen in living organ donations.
Yeah, it's become this really complex mix. You've got genuine desperation, you've got altruism, but it's all tangled up with, well, some serious gaps in the system.
So our mission today is to try and untangle that. Understand why a state that was once out front in deceased donations is struggling now, and what that means for thousands of people waiting.
It's a story with some really surprising turns, I think. It definitely makes you reconsider how these systems work, or sometimes how they don't.
Okay, so to really get a handle on the current situation, we need to look back a bit, right? At Kerala's golden past in this area.
Exactly. Because it wasn't that long ago, around 2016, that Kerala was actually a national leader. They hit 1.03 deceased donations per million people.
Which sounds impressive on its own, but compared to the rest of India.
Oh, it was huge. 4 times the national average, which was only 0.26 per million then. Now, obviously, still a way to go to match global leaders like Spain. They're up at 43.4 per million. But Kerala was definitely showing incredible promise, real momentum.
That really shows what was possible. So what happened? Because the current numbers are, frankly, alarming.
They really are. Fast forward to August 2025, and the official data from KOTO, that's the state's transplant organization, shows just 9 deceased donors, only 24 organs donated.
9 donors, that's compared to.
Compared to 72 deceased donors and 218 major organs back in 2015. It's a massive drop, a really dramatic fall off in less than 10 years.
Wow. So the big question is why? Why such a steep decline?
Well, it seems to be a combination of things, sort of a perfect storm. A major factor, perhaps the biggest, is this erosion of public trust. A shadow of mistrust, you could say.
And that stems mainly from?
A lot of it goes back to negative publicity around a specific case in 2009, the Lakeshore Hospital incident. There were allegations about procedural issues in declaring brain death for a young accident victim.
Ah, okay. And that kind of thing sticks in the public mind.
It really does. And then you layer on top of that the sheer noise of misinformation, especially spreading through social media. It created this climate of suspicion.
So people became wary, and maybe doctors did too.
Precisely. Doctors grew reluctant to declare brain death, fearing potential legal trouble or public backlash. It just added another layer of difficulty. And the state's own program, Rithazan Giovanni, which started in 2012, has really struggled to regain its footing after all that.
Right. And the human cost of this decline, it's devastating when you think about the people waiting.
It's heartbreaking. We're talking about over 2,778 patients in Kerala right now on waiting lists. For kidneys, it's 2,136 people. For livers, 495. For hearts, 82.
And the waiting times.
The projections are grim, exceeding a decade for many. A decade! Imagine waiting that long, living with that uncertainty, that fear. For many, it's simply too long.
It paints a truly desperate picture, and that desperation, I suppose, pushes people towards other options.
Exactly. That leads us straight into this sort of double-edged solution. With deceased organs so scarce, people are turning increasingly to living donors.
And that's a trend across India, not just Kerala.
Yes, nationally it's huge. In 2023, 93% of all organ transplants in India, that's over 18,000 transplants, came from living donors. It's the vast majority.
Wow, 93%. And in Kerala, it's even higher.
Even more pronounced, living donor transplants make up something like 99% of the roughly 1,300 transplants done annually there, primarily kidneys, some livers. It's almost entirely dependent on living donation now.
Which, on one hand, shows incredible generosity.
It does, and living donation itself can be a very good option. It's generally safe, donors can live full lives with one kidney, and it often means a much faster transplant for the patient. That's crucial when time is running out.
But there's a but. The peril, as you called it.
Yes, the peril.
Yeah.
This surge has unfortunately created an opening for Well, for agents and middlemen, it forces us to ask some difficult questions about altruism versus desperation, especially when money enters the picture.
Okay, and this is where the legal framework comes in, or maybe where it falls short.
Precisely. The law, the Transplantation of Human Organs and Tissues Act, THOA, from 1994, is very clear. It strictly bans any payment for organs.
And there are committees meant to check this.
Yes, district-level authorization committees are supposed to scrutinize any donation between unrelated people. Their job is to ensure it's purely altruistic, no money changing hands.
But the reality seems different. MLA Vincent's concern suggests these committees aren't catching everything.
That's the problem. The reports of middlemen are persistent. They're allegedly connecting patients who are desperate and have funds with people willing to donate an organ, often out of their own financial desperation, for cash. The system has cracks.
It really highlights the pressure people are under. You mentioned a specific story.
Yes, Anita from Kochi. Her husband, Suresh, needed a kidney because of diabetes. They searched and eventually found a donor. But it came at a price, R7 lakh.
Which is about, what, 8,000 US dollars?
Roughly, yes. Now, Anita was clear that they followed all the official protocols, got the approvals, but her story just shows how blurred the lines can become.
It does. And Dr. Noble Gracious from Quesoda was quite candid about this.
He was. He basically said, look, the idea that strangers donate organs purely out of altruism is maybe slightly far-fetched in many cases. Money, he said, is a stark reality of live donations.
Which creates this potential for exploitation, doesn't it?
Absolutely. If the oversight isn't robust enough, it leaves vulnerable people, often those in deep poverty, open to being exploited. They might see donating an organ as their only way out of financial hardship. It's a terrible choice to face.
And digging deeper, there are other hidden burdens here, aren't there? Like the gender aspect.
Oh, definitely. This is really striking. Across India, about 63% of living donors are women, which is already skewed.
But in Kerala.
In Kerala, it jumps to 80%.
Ah.
80% of living donors are women. And get this, 80% of the recipients are men.
That is a massive imbalance.
Yeah.
What does that tell us?
It points towards, deeply ingrained societal pressures. Wives, mothers, daughters feeling obligated, perhaps implicitly, perhaps explicitly, to step forward. It raises serious questions about whether women feel they have a genuine choice or if they're sacrificing their own health under duress. A huge societal weight.
It really paints a picture of vulnerability. And these middlemen, this organ trade, it's not exactly new, is it?
Not new, no, but its persistence is the worrying part. There are even reports, of agents arranging travel for donors to places like Iran where compensated donation is actually legal.
So it's becoming organized almost.
It suggests a level of organization, yes. It's this awful cycle. Desperate patients needing organs, desperate people needing money, and middlemen facilitating the transaction, exploiting desperation on both sides.
And the law, the THOA, even with amendments, struggles to stop this.
Enforcement is just really, really difficult. Those district committees, they rely mostly on paperwork, and paperwork, as we know, can be faked or manipulated to hide payments.
And the courts sometimes add another layer of complexity.
Well, yes. Judges face this terrible dilemma. They often prioritize the patient's right to life. So sometimes, even if a case looks a bit suspicious, they might approve the transplant, arguing against unnecessary suspicions, blocking a life-saving procedure.
Which is understandable from a human perspective,
But it can inadvertently allow these financially motivated donations, disguised as altruism, to go ahead. It just shows how flawed the current checks and balances are.
And Matthew Phillip from the Liver Foundation of Kerala, Life Oak, he links this directly back to the struggling deceased donor program.
He does. His point is stark. When the official ethical route deceased donation isn't working well, it inevitably fuels the illegal or unethical trade. And the people most harmed are usually the poor. Plus, that shadow of the 2009 Lakeshore case still hangs over everything, keeping public skepticism alive. It's a vicious cycle.
It sounds incredibly challenging. But amidst all this, there must be stories of hope, examples of genuine altruism.
Oh, absolutely, and it's crucial we remember those. Take Jerry Varghese, a young man from Manasala involved in a tragic road accident in July 2021.
Okay.
He was declared brain dead. And his family, in that moment of immense grief, made the incredibly selfless decision to donate his organs.
That takes extraordinary strength.
It really does. His organs saved 5 lives. The health minister, Veena George, rightly held up his family's decision as a true act of compassion, a model for others.
And you also mentioned the Hitendran effect in Tamil Nadu.
Yes, a powerful example from Kerala's neighbor. Back in 2008, the parents of a teenager named Hidendran, after his tragic accident, donated his organs.
And that had a wider impact.
A huge impact. It sparked this wave of organ donation pledges across Tamil Nadu. It even led to them establishing September 23rd as State Organ Donation Day. It shows how one act of profound generosity can inspire so many others. These stories are vital.
They really are. But for Kerala to see more stories like Jerry Varghese, it needs to tackle those systemic problems head on, doesn't it?
Without a doubt, there are fundamental roadblocks. Many hospitals in Kerala, for instance, just don't have the right infrastructure or, crucially, the trained staff to consistently identify potential brain deaths and certify them correctly.
Which is the very first step for a deceased donation.
Exactly. And then there's a shortage of transplant coordinators. These are the people who do the incredibly sensitive job of talking to grieving families, explaining the process, coordinating everything. Their role is absolutely vital.
And beyond staffing?
You have delays in processing, just general infrastructure gaps, and often a lack of proactive systems to identify potential donors early. These aren't just careless problems, mind you. They're issues across much of India.
But Tamil Nadu seems to have found some solutions. You mentioned their recent surge.
Yes, their progress is quite remarkable. An 18% jump in donations in 2024, 30 deceased donors in January alone. That's significant.
And what's behind that success?
A big part seems to be Transstand, their centralized, transparent allocation system. It ensures organs go where they're most needed, fairly. That builds trust, and they've coupled that with really strong, ongoing public awareness campaigns. It shows what a concerted effort can achieve.
Which contrasts sharply with Kerala's current position.
Unfortunately, yes. Kerala has slipped down the rankings, now 12th nationally in organ pledging. That's likely due to that lingering mistrust, the misinformation we talked about, and maybe a lack of sustained, focused public education to counteract it. The earlier momentum has been lost.
Okay, so bringing it all together, what's the path forward for Kerala? How can they rebuild trust and get the system back on track?
It has to be a multi-layered approach. There's no single magic bullet. First and foremost, revitalizing the deceased donation program is absolutely critical.
The government's 2024 campaign is a start.
It's a crucial step, yes. Actively working to dispel myths about brain death, trying to rebuild that public confidence. Minister Veena George acknowledged how hard it is to detect hidden payments, but stressed that preventing exploitation has to be the priority.
And public awareness needs a boost too.
Definitely. Think bigger. Imagine putting organ donation education into school curriculums, normalizing it early on. Engaging religious leaders, community leaders like Tamil Nadu did, can help overcome some of those cultural or spiritual hesitations people might have.
That makes sense. What about infrastructure?
Kerala actually has an air ambulance system that could potentially be scaled up, used more effectively to retrieve organs from more remote areas quickly, ensuring fewer potential donations are missed due to logistics.
Okay, so boosting deceased donation, raising awareness. What about tackling the middlemen and strengthening oversight?
That's the third key piece. Independent audits of transplant hospitals could help ensure everyone's following the rules strictly. And of course, tougher enforcement of the THOA law itself is needed to deter those middlemen.
Are there other legal avenues, like those exchange donations?
Yes, the paired exchange or swap donations, where say, I want to donate a kidney to my relative, but we're incompatible, and another pair has the same issue, we might be able to swap donors. KNOS, the Kerala Network for Organ Sharing, approved this back in 2018.
So that could provide a transparent legal alternative.
It could, if it's implemented properly and monitored carefully. It offers another legitimate route that avoids the need for unrelated, potentially paid donations.
And finally, that stark gender disparity. What can be done there?
That needs specific, targeted action. Public health campaigns need to actively challenge the assumption that it's always the woman's duty. Encourage men to see donation as a shared family responsibility.
Make it less of an assumed burden on women.
Exactly. And crucially, provide better long-term support for living donors. Think subsidized healthcare, maybe psychological support. Recognizing the huge gift they've given, especially since so many are women, and ensuring it doesn't ruin their own long-term health. That's vital for fairness.
It really feels like Kerala is at a crossroads, doesn't it?
It really does. The potential is still there. The healthcare system is strong in many ways, but it's grappling with these serious issues. The fall in deceased donations, the heavy reliance on living donors, and this troubling undercurrent of commercial exploitation.
But the potential impact of getting it right is just immense.
It's incredible. One deceased donor can save up to 8 lives through organ donation alone. Then there's tissue, eyes. It enhances so many more lives. It really comes down to compassion and ensuring the system supports that compassion fairly.
Kerala really has this chance now to learn, adapt, rebuild that trust, and become a leader again.
They do. And the urgency is real. You think about those 2,700 plus people waiting right now. Their lives literally hang in the balance. It's more than just policy. It's a moral imperative to fix this.
So as we wrap up, it leaves us with a tough question, really. When you see the desperation involved, both for patients needing an organ and for potential donors facing poverty, what's our collective responsibility? How do we ensure this incredible act of giving life remains just that, a gift, and not a transaction born of circumstance?
How do we protect the vulnerable while still saving lives? It's a profound challenge.
Definitely something for all of us to think about. We hope this deep dive has given you some valuable insights and perhaps a little bit of inspiration too.